And this is really an absolutely central series of outcomes, of questions that you have chaired. Joanna, I'd like to start with the questions that you looked at, which actually were twofold. They were poverty diseases, they were neglected diseases, you had problems concerning the regulatory environment, you had a lot of areas. And I'm looking at the first pages in your book here, culminating in page 5. And here, one of the things you talked about was an integrated approach as opposed to niche programs. What's the key difference there? And what do you mean by building health systems, investing in it? Who would be investing? Where would the money come from?
This is a good question.
We start with that one first, all right?
Well, first of all, I would like to make a comment just to remember.
Please excuse me, I'm very rude. Joanna, I forgot to introduce you. Joanna Rubinstein, Chief of Staff to Jeffrey Sachs, and a director herself of the strategic programs at the Earth Institute. I'm very sorry, Joanna, please go ahead.
Thank you, Maria. I would just like to comment, it's a general comment, that if we look at the Millennium Development Goals, there are 8 Millennium Development Goals, and 3 out of the 8 goals are directly related to health. As Jane said, water is relevant to achievement of all the goals. I would like to claim that health is equally relevant to the achievement of all the goals, and that out of the 8 goals, it's more actually than 3 that directly relate to health. To start answering your question, well, what do we mean by integration of different health programs in order to achieve the Millennium Development Goal, which is really reducing child mortality in the world? It is actually unacceptable to have the present situation. We have almost 11 million children. I was told it's actually slightly less now. It's 10.6 million children, which I still find it's 10.6 million children too many, dying every year. More than half of these children die of totally preventable or curable diseases. And 90% of these children die in the poorest countries. So what would it take really to achieve the goal of reducing that horrible death of children? And we're talking about children under the age of 5. Well, there are many, many efforts driven by different big organizations, NGOs, small corporations, by the governments that are focusing on each particular disease. So to give you an example, there are efforts to just immunize children without thinking that the same children don't have access to safe water and maybe don't have even access to food. There are efforts to fight malaria without thinking that the same children have parasites which could be easily cured by just getting 1 pill every year to deworm these kids. There are many, many different kinds of programs that each of them address just one issue of health. And it's very important to try to think from the perspective of the child. It happens to be the same child most often in the rural parts of sub-Saharan Africa or somewhere in villages in South Asia that happens to have all these diseases. So unless we try to have a more integrated approach, which is also going to save a lot of resources, especially human resources for health, we would never be able to achieve. So it's important to go from these vertical programs that we have, just addressing AIDS or malaria, into horizontal programs.
As a matter of fact, on page 10, when you were looking, which also you chaired the other part on neglected diseases, you have here the increased cooperation among the international bodies. And, you know, so I always find it's very interesting to talk about cooperation. Let's say the rubber hits the road when you ask exactly how it's going to happen. The difficulty is actually getting them all in a room or making programs that aren't vertical but horizontal. There are a lot of questions in this, but perhaps you can address some of those questions in looking also at the second part of your session on neglected diseases, which you called for exactly the same kind of cross-cutting integration. What do you mean in this respect also, Joanna, if I could ask you, about the risk-benefit assessments? What do you mean? Are they out of balance? Did you imply that there are double standards in this? And if so, what kind of new standards are you talking about? And then perhaps address in this respect as well the cooperative approaches you're looking at.
There are many different issues, ethical issues, economical issues, that guide us in our process, how we do our different, build our processes for development of drugs and approval of different drugs. When it comes to the double standards, that we should have different standards when developing drugs or vaccines for developing countries versus developed countries, I think we were not in full agreement. Of course, we would like to make sure that there is the same scientific rigor and that we have the same regulatory mechanisms. At the same time, we face the issue of maybe being able to develop vaccines or drugs for the diseases that affect predominantly or today only the developing countries. And that the same vaccines or drugs may have some side effects, may not be 100% safe, but at the same time they would save a lot of lives. If we would use the same vaccines or drugs in the developed world, where it hardly ever happens that the children have these diseases or are exposed to these diseases, we may risk their lives because they would not have been affected by the disease but may get side effects of these drugs or vaccines. And that's the issue. How do we deal with that problem? How do we decide if it's more important to save lives or it's more important to make sure that we don't harm few children?
Thank you very much, Joanna. In this respect, then, Peter Doherty, you're Nobel laureate in medicine in 1996 and a professor at the Department of Microbiology and Immunology at the University of Melbourne. Peter, in your look at immunization for all, as a scientific investigator, as a scientist yourself, you have brought out of that session perhaps one part that seems to me to be we haven't enough looked at, which is the involvement of local communities and local ownership.